Question 1. According to the NMC Code, what is the core responsibility of a registered nurse regarding their professional development? A. To avoid new learning once registered, as competence is established. B. To ensure they remain educated, competent, and up-to-date in their practice. C. To only pursue development if mandated by their employer. D. To delegate all learning to less experienced staff. Answer: B. To ensure they remain educated, competent, and up-to-date in their practice. This question tests your understanding of continuous professional development, a key requirement of the NMC Code. The keyword core responsibility highlights a fundamental expectation for all registered nurses. The NMC Code mandates that nurses must continuously update their knowledge and skills, ensuring they remain educated, competent, and up-to-date to provide safe and effective care throughout their careers. For example, regularly attending training, reading professional journals, or completing online courses helps a nurse adapt to new evidence-based practices. Always remember that learning is a lifelong commitment in nursing, ensuring you deliver the best possible care. Question 2. A patient, who is a devout Muslim, requests a female nurse for personal care, but only male nurses are available on the ward. What is the most appropriate action for the nurse? A. Explain that only male nurses are available and proceed with care. B. Politely explain that specific gender requests cannot be accommodated due to staffing. C. Prioritize the patient's cultural and religious preference by seeking a female colleague from another ward or department if possible, or arrange for male staff to only assist where absolutely essential and with consent. D. Document the refusal and postpone personal care until the next shift. Answer: C. Prioritize the patient's cultural and religious preference by seeking a female colleague from another ward or department if possible, or arrange for male staff to only assist where absolutely essential and with consent. This question tests your cultural competence and commitment to person-centered care, as outlined in the NMC Code. The keywords devout Muslim, requests a female nurse, and only male nurses available highlight a potential conflict between patient preference and staffing. The most appropriate action is to demonstrate cultural sensitivity by making every reasonable effort to accommodate the patient's request, respecting their religious beliefs and dignity, while also ensuring essential care is still provided safely. For instance, a male nurse could offer to perform only the necessary clinical tasks if a female colleague is unavailable for personal care, after explaining the situation and gaining consent. Always remember to respect and accommodate a patient's cultural and religious beliefs whenever safely possible. Question 3. A patient's prescription is for paracetamol 1g PRN, as needed E, for pain. The nurse assesses the patient and they report pain of 6/10. The last dose of paracetamol was 2 hours ago. The prescription specifies a minimum interval of 4 hours between doses. What is the nurse's most appropriate action? A. Administer the paracetamol 1g immediately, as the patient is in pain. B. Administer half the dose, 500 mg, to provide some relief. C. Explain to the patient that it is too soon for the next dose, and assess alternative pain relief strategies or non-pharmacological interventions, while planning to reassess at 4 hours. D. Document the pain and wait for the 4-hour interval to pass, without further action. Answer: C. Explain to the patient that it is too soon for the next dose, and assess alternative pain relief strategies or non-pharmacological interventions, while planning to reassess at 4 hours. This question tests your adherence to safe medication administration principles and effective pain management. The keywords paracetamol 1g PRN, last dose 2 hours ago, and minimum interval of 4 hours highlight a clear breach of prescription guidelines if administered. The most appropriate action is to prioritize patient safety by adhering to the prescribed interval, while still addressing the patient's pain through alternative or non-pharmacological methods and reassessing their needs later. For example, a nurse could offer a distraction, reposition the patient, or check if another type of PRN analgesic is prescribed with a different interval. Always remember that medication safety rules, including dosing intervals, are non-negotiable and designed to protect patients. Question 4. What is the primary purpose of conducting a patient handover between nursing shifts? A. To allow nurses to socialize and discuss their day. B. To provide a comprehensive, organized update on patient status, care needs, and any changes, ensuring continuity and safety. C. To assign blame for any incidents that occurred during the previous shift. D. To review the patient's entire medical history in detail. Answer: B. To provide a comprehensive, organized update on patient status, care needs, and any changes, ensuring continuity and safety. This question tests your understanding of effective communication in healthcare, particularly during transitions of care. The keyword primary purpose focuses on the core reason for handovers. Patient handovers are essential for ensuring that critical information about a patient's condition, treatment plan, and any changes in their status is accurately and systematically transferred between shifts, thereby maintaining continuity of care and promoting patient safety. For example, a good handover would include recent vital signs, current medications, and any immediate concerns, ensuring the next nurse is fully prepared. Always remember that a clear and comprehensive handover is vital for seamless and safe patient care. Question 5. A nurse observes a red, non-blanching area on a patient's sacrum, which indicates a Category 1 pressure ulcer. What is the nurse's most appropriate initial action? A. Document the finding and continue to monitor. B. Apply a standard dressing and inform the doctor on the next ward round. C. Implement immediate pressure-relieving measures, document the assessment, inform the multidisciplinary team, and update the care plan. D. Vigorously massage the affected area to improve circulation. Answer: C. Implement immediate pressure-relieving measures, document the assessment, inform the multidisciplinary team, and update the care plan. This question assesses your ability to identify and respond to early signs of skin breakdown. The keywords red, non-blanching area, Category 1 pressure ulcer, and most appropriate initial action highlight the urgency of intervention. The most appropriate action is to immediately reduce pressure on the affected area, document the finding thoroughly, notify the multidisciplinary team, including a tissue viability nurse if available, and revise the patient's care plan to include specific preventative and treatment strategies. For example, repositioning the patient, ensuring a pressure-relieving mattress, and padding bony prominences are crucial steps. Always remember that early identification and prompt intervention are key to preventing pressure ulcers from worsening. Question 6. What is the nurse's ethical responsibility when a competent patient expresses a wish to refuse a prescribed medication, even if the nurse believes it is vital for their health? A. Attempt to convince the patient to take the medication, as it is in their best interest. B. Administer the medication covertly if the patient is confused. C. Respect the patient's autonomous decision after ensuring they have been provided with all necessary information to make an informed choice, and document their refusal. D. Inform the patient's family to persuade them to take the medication. Answer: C. Respect the patient's autonomous decision after ensuring they have been provided with all necessary information to make an informed choice, and document their refusal. This question tests your understanding of patient autonomy and informed consent, core ethical principles in nursing. The keywords "competent patient expresses a wish to refuse a prescribed medication" are crucial. When a patient has the mental capacity to make decisions, their right to autonomy, the right to make choices about their own body and care, must be respected, even if healthcare professionals disagree. The nurse's role is to ensure the patient is fully informed about the risks and benefits of their decision, then respect and document their choice. For example, if a patient with capacity refuses a flu vaccine, the nurse explains the risks and benefits, documents the refusal, and respects their decision. Always remember that a competent patient has the final say over their own treatment. Question 7. A nurse is preparing to administer a medication that requires a specific calculation. They are unsure about the correct dose. What is the most appropriate action for the nurse? A. Estimate the dose based on their experience. B. Ask a colleague to quickly calculate it without double-checking. C. Consult a reliable medication reference, verify the calculation with another registered professional, or clarify with the prescriber. D. Administer a lower dose to be safe. Answer: C. Consult a reliable medication reference, verify the calculation with another registered professional, or clarify with the prescriber. This question tests your adherence to medication safety protocols, especially concerning drug calculations. The keyword "unsure about the correct dose" indicates a high-risk situation where an error could cause serious patient harm. The most appropriate action is to halt administration and ensure accuracy by consulting official resources, having a second registered professional verify the calculation, or directly clarifying with the prescriber. For example, if calculating an infusion rate, you would use a calculator, check with a colleague, and confirm the final dose with the doctor if still uncertain. Always remember that medication calculations must be 100% accurate, and seeking help when unsure is a sign of professionalism, not weakness. Question 8. What is the legal framework in the UK that protects a person's right to make their own decisions about their care and treatment, even if they lack capacity? A. The Human Rights Act. B. The Mental Health Act. C. The Mental Capacity Act. D. The Data Protection Act. Answer: C. The Mental Capacity Act. This question assesses your knowledge of key legal frameworks governing patient rights in the UK. The phrase "protects a person's right to make their own decisions, even if they lack capacity" points directly to the Mental Capacity Act, MCA. 2005. The MCA provides a legal framework for making decisions on behalf of individuals aged 16 or over who lack the mental capacity to make their own decisions, always in their best interests and with a presumption of capacity. For example, if an elderly patient with severe dementia needs a medical procedure, decisions would be made following the MCA's principles. Always remember that the Mental Capacity Act ensures that decisions for those lacking capacity are made in their best interest and with respect for their rights. Question 9. A nurse has identified a potential safeguarding concern regarding a vulnerable adult in the community. What is the nurse's immediate responsibility? A. Confront the alleged abuser directly. B. Document the concern and monitor the situation for a few more days. C. Report the concern to the appropriate local safeguarding authority, e.g., Local Authority Social Services, according to policy. D. Discuss the concern with the patient's family without seeking further guidance. Answer: C. Report the concern to the appropriate local safeguarding authority, e.g., Local Authority Social Services, according to policy. This question tests your knowledge of safeguarding responsibilities, a critical aspect of protecting vulnerable individuals. The keywords potential safeguarding concern and vulnerable adult indicate a duty to act. The immediate and most appropriate action is to follow local safeguarding policies by reporting the concern to the designated safeguarding lead or the appropriate local authority social services, ensuring the safety of the vulnerable person. For example, if you suspect neglect, you must report it, not ignore it, to ensure an investigation can begin. Always remember that safeguarding vulnerable people is a non-negotiable professional and ethical duty. Question 10. A patient reports feeling dizzy when standing up quickly. Their blood pressure is noted to be lower than their usual baseline. What is the most appropriate nursing intervention? A. Advise the patient to avoid standing up too quickly and assist them with mobilization. B. Tell the patient it is a normal part of aging. C. Encourage the patient to stay in bed to prevent falls. D. Administer a blood pressure-raising medication without a doctor's order. Answer. A. Advise the patient to avoid standing up too quickly and assist them with mobilization. This question assesses your ability to identify and manage orthostatic hypotension, a common fall risk. The keywords dizzy when standing up quickly and blood pressure is noted to be lower than their usual baseline indicate a risk of falls due to a drop in blood pressure upon changing position. The most appropriate nursing intervention is to provide practical advice to mitigate this risk, such as teaching them to stand up slowly and offering assistance with movement. For example, a nurse would help the patient dangle their legs at the bedside for a few minutes before standing. Always remember to implement practical, preventative measures to enhance patient safety, especially for fall risks. Question 11. What is the primary purpose of an individualized care plan for a patient? A. To serve as a legal document for hospital audits. B. To ensure all patients receive the same standard of care. C. To outline specific, person-centered interventions and goals tailored to meet the unique needs of an individual patient. D. To dictate the nurse's workload for the shift. Answer. C. To outline specific, person-centered interventions and goals tailored to meet the unique needs of an individual patient. This question tests your understanding of person-centered care and the purpose of care planning. The keyword primary purpose focuses on the core reason for this essential document. An individualized care plan is crucial because it ensures that care is specifically tailored to the unique needs, preferences, and goals of each patient, promoting their well-being and involving them in their care journey. For example, a care plan for a patient with diabetes would include specific dietary and activity goals relevant to them. Always remember that care plans are living documents designed to guide person-centered and holistic care. Question 12. A nurse is preparing a patient for surgery. The patient states they have not fully understood the information provided by the surgeon and still have questions. What is the nurse's most appropriate action? A. Tell the patient the surgeon is busy and will answer questions later. B. Reassure the patient that the surgeon knows best. C. Facilitate further discussion with the surgeon to ensure the patient has full understanding before proceeding with consent. D. Sign the consent form on behalf of the patient to speed up the process. Answer. C. Facilitate further discussion with the surgeon to ensure the patient has full understanding before proceeding with consent. This question assesses your role in ensuring informed consent, a cornerstone of ethical patient care. The keywords "not fully understood the information" and "still have questions" indicate that genuine informed consent has not yet been achieved. The nurse's most appropriate action is to advocate for the patient by ensuring they have all necessary information and their questions are answered by the appropriate healthcare professional, the surgeon, before signing any consent form. For example, the nurse would explain to the surgeon that the patient needs more time to understand and have their questions answered. Always remember that a patient's understanding and voluntary agreement are paramount for valid consent. Question 13. A patient with a urinary catheter complains of lower abdominal pain and tenderness. The urine in the bag is cloudy and offensive smelling. What is the nurse's immediate priority? A. Change the urinary catheter immediately. B. Administer a PRN analgesic and continue to monitor. C. Assess the patient for signs of a urinary tract infection, take a urine sample for culture, and escalate findings to the medical team. D. Advise the patient to drink more fluids. Answer: C. Assess the patient for signs of a urinary tract infection, take a urine sample for culture, and escalate findings to the medical team. This question tests your ability to recognize and respond to signs of a urinary tract infection, UTI, in a catheterized patient. The keywords urinary catheter, lower abdominal pain and tenderness, and cloudy and offensive-smelling urine strongly indicate a potential UTI. The immediate priority is a thorough assessment, collecting a urine sample for culture to identify the causative organism, and promptly escalating these findings to the medical team for consideration of antibiotic therapy. For instance, documenting the symptoms and vital signs before informing the doctor ensures a complete picture for treatment. Always remember that early identification and treatment of UTIs in catheterized patients are crucial to prevent more serious complications. Question 14. What is the legal requirement for reporting concerns about a colleague's fitness to practice to the NMC? A. It is optional and depends on the severity of the concern. B. It is a mandatory requirement if you believe their practice may be impaired and could put patients at risk. C. It is only required if the colleague admits to an error. D. It is the responsibility of the employer, not individual nurses. Answer: B. It is a mandatory requirement if you believe their practice may be impaired and could put patients at risk. This question assesses your understanding of professional accountability and the duty to raise concerns as stipulated by the NMC. The keyword legal requirement highlights the mandatory nature of this responsibility. The NMC Code explicitly states that nurses have a professional and legal duty to report concerns about a colleague's fitness to practice if they believe it could compromise patient safety or public confidence. For example, if you observe a colleague regularly appearing at work under the influence of alcohol, you have a duty to report this. Always remember that protecting patients from harm, even when it involves a colleague, is a fundamental professional obligation. Question 15. A patient's family informs the nurse that the patient prefers to wear their own clothes rather than hospital gowns. What is the nurse's most appropriate action? A. Explain that hospital gowns are standard policy for all patients. B. Politely decline, citing infection control risks. C. Respect the patient's preference and facilitate the use of their own clothing, ensuring it is clean and practical for care. D. Ask the patient why they do not like hospital gowns. Answer: C. Respect the patient's preference and facilitate the use of their own clothing, ensuring it is clean and practical for care. This question tests your commitment to person-centered care and respecting patient dignity and autonomy. The keywords patient prefers to wear their own clothes highlight a personal preference that should be accommodated where possible. The most appropriate action is to respect the patient's choice and facilitate it, ensuring their clothing is clean, comfortable, and does not hinder necessary clinical procedures. For example, you would help the patient change into their pajamas if appropriate, rather than insisting on a hospital gown. Always remember that respecting a patient's personal choices helps maintain their dignity and promotes their sense of well-being. Question 16. What is the definition of informed consent in healthcare? A. Obtaining a signature on a consent form, regardless of patient understanding. B. The patient agreeing to treatment after being given all relevant information in an understandable way, voluntarily, and with capacity. C. The family agreeing to treatment on behalf of a competent patient. D. A verbal agreement from the patient to undergo any procedure. Answer: B. The patient agreeing to treatment after being given all relevant information in an understandable way, voluntarily, and with capacity. This question assesses your understanding of the fundamental principle of informed consent. The phrase definition of informed consent calls for a comprehensive explanation of its core components. Informed consent means that a competent patient must receive all relevant information about a proposed treatment, benefits, risks, alternatives, understand it fully, make a decision voluntarily without coercion, and have the mental capacity to do so. For example, before a patient agrees to surgery, the nurse ensures they've had the procedure explained clearly, had their questions answered, and are making their decision freely. Always remember that true informed consent is about patient empowerment and respecting their right to choose. Question 17. A nurse observes a colleague struggling emotionally after a particularly distressing patient death. What is the nurse's most appropriate action? A. Suggest they take a long break from nursing. B. Ignore it, as everyone deals with grief differently. C. Offer compassionate support, encourage them to talk, and signpost to available staff support services, e.g., counseling, occupational health. D. Report them to the ward manager for emotional instability. Answer: C. Offer compassionate support, encourage them to talk, and signpost to available staff support services, e.g., counseling, occupational health. This question tests your understanding of professional support and compassionate teamwork, reflecting the NMC Code's emphasis on acting with integrity. The keywords struggling emotionally and distressing patient death indicate that a colleague is in need of support. The most appropriate action is to offer empathy and practical support, encouraging them to access available professional support services to safeguard their own well-being and fitness to practice. For instance, you could gently ask, "Are you okay? That was a really difficult situation. Remember, our staff counseling service is there if you need to talk." Always remember to support your colleagues' well-being, as this fosters a resilient and healthy work environment. Question 18. What is the most effective method to prevent the spread of healthcare-associated infections? A. Wearing sterile gloves for all patient contacts. B. Routine environmental cleaning. C. Adhering to strict hand hygiene protocols. D. Administering prophylactic antibiotics to all patients. Answer: C. Adhering to strict hand hygiene protocols. This question tests your fundamental knowledge of infection prevention and control. The keyword most effective method directs you to the single most impactful action. Adhering to strict hand hygiene protocols, hand washing with soap and water or using alcohol-based hand rub at the 5 moments for hand hygiene, is consistently proven to be the most effective measure in preventing the transmission of healthcare-associated infections. For example, washing your hands thoroughly before and after every patient contact significantly reduces the number of microbes transferred. Always remember that proper hand hygiene is your first and best defense against infection spread. Question 19. A patient is being discharged home and needs to take a new medication. The patient has poor literacy skills. What is the nurse's most effective teaching strategy? A. Provide a detailed written leaflet for the patient to read at home. B. Tell the patient to ask their family to read the instructions to them. C. Use simple verbal explanations, demonstrate administration if applicable, use visual aids, and encourage teachback to confirm understanding. D. Administer the first dose at discharge and assume they will manage the rest. Answer: C. Use simple verbal explanations, demonstrate administration if applicable, use visual aids, and encourage teachback to confirm understanding. This question assesses your ability to adapt patient education for individuals with specific learning needs. The keywords poor literacy skills indicate that written information alone will be ineffective. The most appropriate strategy involves using clear, simple verbal instructions, demonstrating practical skills, incorporating visual aids, and using the teach-back method, asking the patient to explain in their own words, to confirm their understanding. For example, when teaching how to use an inhaler, the nurse would demonstrate, then ask the patient to show them how they would use it. Always remember to tailor your teaching methods to the patient's individual learning needs to ensure comprehension and adherence. Question 20. What is the correct procedure for safely managing a dropped sterile instrument during a procedure? A. Quickly pick it up and continue using it if it still looks clean. B. Wash it under tap water and then continue using it. C. Immediately consider it contaminated, remove it from the sterile field, and replace it with a new sterile instrument. D. Keep it on the sterile field but avoid using it directly on the patient. Answer: C. Immediately consider it contaminated, remove it from the sterile field, and replace it with a new sterile instrument. This question tests your knowledge of maintaining aseptic technique and patient safety during sterile procedures. The phrase dropped sterile instrument indicates a breach of sterility. The correct procedure is to immediately consider any dropped instrument as contaminated, remove it from the sterile field, and replace it with a new, genuinely sterile instrument to prevent the introduction of microorganisms and potential infection. For example, if a sterile forceps falls to the floor, it must be discarded and a new one retrieved. Always remember that maintaining a sterile field is paramount to preventing infection, and any breach must be addressed immediately. Question 21. A nurse is documenting a patient's care. Which entry best reflects professional standards? A. Patient was very annoying all shift. B. Patient appears much better today. C. Patient restless and agitated at 22:00. Repositioned, offered warm drink, remains agitated. MDT informed. To monitor closely. D. Patient slept well after I gave them pain meds. Answer: C. Patient restless and agitated at 22:00. Repositioned, offered warm drink, remains agitated. MDT informed. To monitor closely. This question assesses your understanding of effective and professional documentation standards. The phrase best reflects professional standards points to clarity, objectivity, and comprehensiveness. Professional documentation should be factual, objective, specific, and include assessment, interventions, and outcomes, avoiding subjective judgments. For example, instead of patient was annoying, a professional note records observable behaviors, interventions, and the patient's response. Always remember that clear, objective, and thorough documentation is essential for continuity of care and professional accountability. Question 22. A patient experiences an unexpected fall from their bed. What is the nurse's immediate priority after ensuring the patient's safety? A. Complete an incident report form. B. Call the patient's family to inform them. C. Thoroughly assess the patient for injuries, vital signs, and neurological status. D. Move the patient back into bed immediately. Answer: C. Thoroughly assess the patient for injuries, vital signs, and neurological status. This question tests your ability to prioritize immediate post-fall care. The phrase "after ensuring the patient's safety" clarifies that initial physical safety has been addressed. The immediate priority then becomes a comprehensive assessment of the patient's physical condition to identify any injuries, check vital signs, and assess neurological status for any changes that might indicate head trauma or other serious harm. For example, checking for bruises, fractures, or altered consciousness is crucial before attempting to move the patient. Always remember that a thorough post-fall assessment is critical for identifying and responding to potential injuries. Question 23. What is the nurse's primary role in promoting health and preventing illness in the community? A. To only treat sick individuals in the hospital. B. To educate individuals and groups on healthy lifestyles and offer screening where appropriate. C. To enforce public health policies through legal means. D. To distribute medication to all community members. Answer: B. To educate individuals and groups on healthy lifestyles and offer screening where appropriate. This question tests your understanding of the broader public health role of nursing. The keyword "primary role" in promoting health and preventing illness in the community indicates a proactive, educational approach. Nurses are essential in community health for educating people about healthy lifestyle choices, offering preventative health advice, and facilitating access to screening programs. For example, a community nurse might run a session on healthy eating for children or advise adults on routine cancer screening. Always remember that nurses are key advocates for health education and illness prevention across all settings. Question 24. A patient tells a nurse they are feeling suicidal. What is the nurse's immediate and paramount responsibility? A. Document the statement and monitor the patient closely. B. Inform the patient's family so they can provide support. C. Conduct an immediate risk assessment, ensure the patient's safety, e.g., constant observation, removal of harmful items, and escalate to the multidisciplinary mental health team. D. Counsel the patient on why suicide is not the answer. Answer: C. Conduct an immediate risk assessment, ensure the patient's safety, e.g., constant observation, removal of harmful items, and escalate to the multidisciplinary mental health team. This question addresses a critical mental health emergency and the immediate duty of care. The phrase "feeling suicidal" indicates an urgent and serious risk to the patient's life. The nurse's immediate and paramount responsibility is to conduct a rapid risk assessment to determine the level of danger, implement all necessary safety measures, such as constant observation or removing potential means of harm, and immediately escalate the concern to the mental health team or a medical doctor. For example, ensuring the patient is never left alone and initiating a formal mental health assessment is crucial. Always remember that any suicidal ideation must be taken seriously and acted upon immediately to ensure patient safety. Question 25. What is the principle of best interests when making decisions for a patient who lacks mental capacity? A. Decisions should always align with what the family wants. B. Decisions should reflect what the healthcare professional believes is medically best, regardless of other factors. C. Decisions must consider all relevant factors, including the person's past wishes, values, beliefs, and involving all relevant parties, to achieve the most beneficial outcome for that individual. D. Decisions should be made to reduce costs for the healthcare system. Answer C. Decisions must consider all relevant factors, including the person's past wishes, values, beliefs, and involving all relevant parties, to achieve the most beneficial outcome for that individual. This question tests your understanding of the best interests principle under the Mental Capacity Act. The phrase principle of best interests when making decisions for a patient who lacks mental capacity is central. The Mental Capacity Act mandates that decisions made on behalf of someone lacking capacity must be in their best interests, taking into account all relevant circumstances, including their past wishes, feelings, beliefs, and values, and involving family or advocates. For example, if a patient with dementia previously expressed a dislike for certain foods, this preference should be considered when planning their meals, even if they can no longer communicate it. Always remember that best interests is a holistic concept that prioritizes the individual's unique situation and preferences, not just medical necessity.